Okay, let's start. Okay, good morning, everyone. On this rainy day, today presentation is about understanding holiday stress by Nicole Butler. So Dr. Nicole Butler specializes in adult psychotherapy and uses evidence-based treatments, including cognitive behavioral therapy and mindfulness-based cognitive therapy to help patients with anxiety, depression, mood disorder, trauma, stress, life transitions, and related disorder. Dr. Butler strives to provide a caring and collaborative environment for patients to identify and achieve their goals, as well as explore the difficulties they might be experiencing. So, Dr. Butler, take it away.
Jessie, thank you for that introduction. I'm going to go ahead and share my screen with you all. Okay. Can everybody see the PowerPoint?
Yes, I see it.
You can see it? Okay, excellent. All right. So today I'm going to be talking about understanding stress in the context of the holidays. So a brief outline of what we're going to cover. We'll be talking about an overview of stress. Then I'm going to go into theories of stress. Then I'm going to ask everyone to engage in a holiday stress activity. Then I'm going to talk about some stress and the holiday research. Then I'm going to give some ideas for how to cope with holiday stress. And then we'll end with a stress management peaceful place activity. Okay, so stress has many definitions. One of the most common is physical, mental, or emotional strain or tension. Stress is a condition or feeling experienced when a person perceives that demands exceed their personal and social resources that the individual is able to mobilize. So stress is your body's response to anything that requires attention or action. Everyone experiences stress to some degree, and the way you respond to stress makes a big difference to your overall well-being. So most people consider stress to be something that causes distress, but stress is not always harmful. So a definition of stress should also embrace this healthy stress, which is usually ignored when you ask people to define stress. So healthy stress, right? Increases in healthy stress could increase productivity. For example, if you're feeling stressed about a big test, it might motivate you to prepare and to study. So stress and cognitive behavioral therapy. So I am a cognitive behavioral therapist. And as you can see on your screen, this is the CBT model. So the model posits that situations happen around us all day long. We then interpret the situation. We have thoughts about the situation. Our thoughts then lead to feelings and emotions. And our feelings and emotions lead to behaviors and actions. And behaviors and actions in turn lead to more thoughts. So an example that might highlight the model in the context of stress in the holidays. So let's say you're driving to a holiday dinner, right? Those are the facts. That's the situation. And you start to have thoughts of, my aunt is going to ask me why I'm still single. It's going to be so embarrassing. I'm going to be embarrassed. I'm embarrassing. Those types of thoughts can lead to feelings of anxiety, fear, perhaps shame. And those feelings and emotions might lead to behaviors of avoiding your aunt at the holiday, perhaps being standoffish, maybe curt or rude. And then afterwards, as a result of those behaviors, you might have thoughts like, I wish I hadn't behaved like that. She didn't even ask me why I'm still single. Right? So in CBT, we try to target and break up this cycle by either changing the situation, which we call stimulus control, right? So what's in your control? What can you modify? Can you modify the stressor, like perhaps spending less time with your aunt? But, in reality, you can't always change the stressor. So then we try to change our thoughts. We try to modify how we view the situation and how we perceive it to decrease levels of stress. Okay. So this is one of the main theories of stress. It's the general adaptation syndrome. It's a three-part theory. There's alarm, resistance, and then exhaustion. So when you encounter a perceived threat, your hypothalamus, which is a tiny region at the base of your brain, it sets off an alarm system in the body. So many people know this system as the fight or flight response. So through a combination of nerve and hormonal signals, the system prompts your adrenal glands to release a surge of hormones, including adrenaline and cortisol. So adrenaline increases your heart rate, it elevates your blood pressure, and it boosts energy supplies. Cortisol is the primary stress hormone, and it increases glucose, so sugars in the bloodstream. It enhances your brain's use of those sugars, and then it increases the availability of substances to repair tissues. So cortisol actually curbs the functions that would be non-essential or even harmful in the fight or flight response. So it alters the immune system, it suppresses the digestive system, it suppresses the reproductive system, and it halts growth. So this is a complex, right, natural alarm system. And in order to turn on the alarm system, all of the parts of your body that are involved in resting, in relaxing, in digestion, or in growth are turned off. So it's important to keep that in mind when thinking about chronic stress. So chronic stress is when your body stays alert even when there's no danger, right? So again, when fight or flight is activated, it halts, it turns off the part of the nervous system that's responsible for resting. So some people might experience from chronic stress, high blood pressure, anxiety, insomnia, a weakened immune system, which is particularly important around this time when there's lots of stuff going around, digestive upset, muscle tension and pain, weight gain, as well as irregular menstrual cycles. So stress and anxiety, I wanted to spend a minute just explaining the difference between the two, because a lot of people can, get them confused. So stress is generally a response to an external cause, such as taking a big test or arguing with a friend. Stress typically goes away once the situation is resolved. And like I mentioned before, it can be both positive or negative. For example, right, it might inspire you to meet a deadline, or it might cause you to lose sleep. Anxiety is generally internal, meaning it's your reaction to stress. It usually involves a persistent feeling of apprehension or dread that doesn't go away and that can interfere with your daily life. So anxiety can be present even if there is no immediate threat. And one of the big differences between stress and anxiety is anxiety can be a disorder, right, with a diagnosis, while stress is not. But both stress and anxiety can affect your mind and your body. So the symptoms might be excessive worry, uneasiness, tension, headaches or body pain, high blood pressure, or loss of sleep. So stress in the holidays, right? That's what the rest of this presentation is going to be about. So stress around the holidays is normal and expected. 56% of people said they're overwhelmed with just keeping up of the demands of the holiday season. 50% of people report stress about financial concerns. 46% report stress about shopping for gifts. 33% report feeling stressed about family events. And 26% of people report stress about their own health. So the most wonderful time of the year might also be the most stressful. All right, so I'm going to encourage everyone to engage in this activity. It is a stress and the holiday word cloud. Oops. So I'm going to send this link in the chat box and ask everyone to fill it out. It should take about a couple of minutes. So if you wouldn't mind hanging with me while I drop this in the chat. All right, so the link is in the chat box. Click on the link, put in some responses, and then I'm going to pull up the results. If there's any trouble with the link, please do let me know. All right, I see the results coming in. All right, some results are still coming in, but I'll start to share my screen. Okay. All right. Can everybody see the screen of the word cloud? All right, I'll take that as a yes. Great. So when you all entered some responses for what are the biggest stressors around the holiday season, the bigger the word is, the more votes it got. So we can see that family is in this group one of the biggest stressors, along with money, gifts. I see grief, I see work. Within those categories, there's other activities around work, more gift giving, shopping, in-laws connects to family talk down, right? A lot of different events to do, social events, gifts, too much cooking. So as you can see, there's a lot of different stressors around the season, yet some of them are pretty common. So we're going to keep this in mind as we continue with the presentation, but thank you for everybody for filling this out. Okay. Right. So I have to note, stress in the holidays is not my primary area of research. So I had to turn to the literature to see what research has been done on this topic. And I found this seminal study by Greenberg, Pilon, and Rosner, who conducted a telephone survey of 786 adults. It was conducted in October 2006. And telephones were generated through a random digit dial process. The sample was stratified by state, and the data were weighted to try and reflect, to try to have an accurate reflection of the population. Okay, so findings. The researchers found when they asked the question, in general, during the holidays, would you say the level of stress in your life increases, decreases, or stays about the same? You can see that for about half of the sample, so 50%, said that it stays the same, while 38% said that stress increases, and 8% reported that it decreases. Diving into the sample, so people who were in the lower to middle income range, so this is 30,000 to 50,000 household income annually, were more likely to report an increase in stress during the holidays. So the researchers posit that people in this category have additional demands on them in terms of finances, right? To purchase and afford material goods during the holiday season, trying to put together a memorable holiday for the family, paying for travel, giving gifts, giving the kids gifts, presents that they might want. And in the process, it might actually build up to having credit card debt. The researchers found that younger folks, so people who are 30 and below, were more likely to report decreases in stress around this holiday time. And the researchers posit that maybe respondents in this group were less likely to have holiday responsibilities. An interesting note was they asked people, what's your least favorite part of the holiday season? And there was no consensus. Some of the bigger ones were bad weather, money, and family. But again, there was no clear consensus on what's everyone's least favorite part. So findings, holiday stress by gender. In the research, these researchers have conducted research outside of the holidays, and they found that women struggle with stress created by work and home responsibilities more so than men in general. But during the holidays, women's stress, it takes on additional demands, right? So it's especially during family celebrations. So while these added demands are stressful to women, they might not always interfere entirely. And we'll go into that in just a minute. But some of these demands might actually bring some positive feelings. But in this graph, in this bar chart, what you can see is that women were more likely than men to report that they felt stressed due to lack of money. So this is 69% of women versus 55% of men. Pressure giving gifts. So this is 51% of women versus 42% of men. And then lack of time. So 69% of women endorsed feeling stress about lack of time, whereas 63% of men reported feeling stressed due to lack of time. So work versus home. So outside of the holiday period, these researchers found that stress during the regular year is more so in the work domain than in the home domain typically. The biggest work stressors include low salaries and wages, lacks of opportunities for advancement on the job, as well as workload. So these stressors remain, but they take on a different character around the holiday season. So financial issues are one of the leading causes of stress around the holidays. And people have worries, right? This is what they report, but how to pull off a successful holiday given financial challenges. During the holidays, people also find that there's pressure to participate in work-related holiday celebrations. And people worry about balancing work and home life. What if work intrudes into home life during the holidays and they won't have enough time to spend with family? So during the season, work remains the primary cause of stress for most people in the United States. And 56% of people report that it's their greatest source of stress versus 29% of people who report that their primary concern, their primary area of stress is in the home. The researchers asked the sample a question of, how often do you experience any of the following during the holidays? So as you can see, 68% of the respondents endorsed feeling fatigued, 61% endorsed feeling stressed, 52% endorsed feeling irritability, and then we have following bloating, sadness, anger, and loneliness. So we have more than half of the sample endorsing fatigue, stress, and irritability, which can impact, right, enjoying the holidays. On the flip side, the researchers also asked the sample, how often do you experience any of the following during the holidays? Happiness, 96% endorsed feeling happiness, often or sometimes. 90% endorsed feeling love, often or sometimes. 89% high spirits, 68% connectedness, and 64% extra energy. So even though the holidays are a particularly stressful time, they're also a beautiful and fulfilling time. And so being able to tap into some of these positive experiences is something we'll continue to talk about when we go into some specific holiday stressors, but it's going to be helpful in terms of reframing thoughts on the holidays. Okay, so stress management techniques. I wanted to give some information about some of the most well-supported stress management techniques. So the first is remove the stressor, which might sound a little obvious, but if you can get rid of the stressor, I would encourage you to do that, right? This is stimulus control. What can you change about reality? Sometimes you can remove the stressor, but it's not always feasible. So if you can't remove the stressor, I would encourage you to modify your perspective of the stressor. So this is changing your thoughts. This is examining your thoughts to see if you can view the situation differently. Seeking social support is also very well supported in the research. It can help with connectedness, accountability, and it can help remind you that you're actually not alone, even if you feel very lonely during this time. Meditation and breath work. So this is a really great stress management technique because it activates the parasympathetic nervous system. So this is the side of the nervous system that is in charge of resting and digesting. So meditation and breath work can slow down your heart rate, slow down breathing, can lower blood pressure, and again, it can promote digestion. So it works by letting the body know that everything is okay. Also relaxing muscles, more so for women, but women hold tension and stress in neck and shoulders. So if you can practice getting your body to relax, perhaps engaging in a progressive muscle relaxation, splurging and treating yourself to a massage, right? Relaxing your muscles can also activate this restful, the parasympathetic nervous system. Consistency. Consistency is so important for stress management. So consistency in sleep. So this is going to sleep at the same time every night and waking up at the same time every day. Consistency in nutrition. So whatever your typical meal schedule is, keeping to it. And then consistency in exercise. I also wanted to include on this list seeking help. If you are trying to engage in these stress management techniques and you're still finding yourself struggling or that your level of stress is very high, I encourage you to seek help. There's lots of great resources out there. And sometimes having a professional guide you and support you and walk you through some of these techniques could be exactly what's needed. So now stress in the holidays. I'm going to go through a number of stressors. A lot of them were reported in the word cloud activity, and I'm going to suggest some techniques to cope with them. So COVID-19 and illness, right? This is the major factor that was not included in the 2006 study. I think it's particularly relevant now because a lot of stuff is going on. They're reporting it's going to be a particularly bad flu season. So stressors versus how to cope. Stressors could include COVID or other illnesses, large gatherings indoors, and then spending time with family or friends who might have different viewpoints on gatherings and being together in the midst of the pandemic. So there's three things that we can do with this. The first is protection, right? So this is vaccines and boosters, as well as testing, right? Tests are more readily available now. So doing the things you can to protect yourself during this time. Then we have stimulus control. So these are the bits that you can do, things you have control over, changes you can make that can help protect you and feel better, like wearing a mask, opening windows, washing and sanitizing hands, right? So these are the areas that you can do, you have control over. And then in terms of relationship factors, I would encourage people to plan ahead. talk to your families, conduct risk-benefit analyses, right? What is your comfort level? And if gathering or being with family is outside of your comfort level at this time, connect virtually, right? FaceTime, Zoom calls, phone calls. Try to continue to stay connected, even if you're not gathering in person. Finances. So again, finances are the biggest source of stress for people around this time. So finances or stress about finances might include gifts and money, social pressures about what you should be spending or what you should be getting, as well as delivery time. So again, thinking about how to cope with these stressors in terms of stimulus control, so the things you can do, or changing your mindset. So spending, or make a spending plan or a budget, right? Map out how much you are willing to spend this holiday season and stick within the budget. What might happen though is people might have should statements after they set their budget. Like, I should be spending more. I should get X, Y, and Z for my kids. And so I encourage you to eliminate should statements from your thoughts. So should statements can be connected to feelings of fear and worry. They put unreasonable demands upon yourself. And if you can't reach those demands, it can result in feelings of guilt and shame, right? So going and returning back to the CBT model, right? Situation might happen, it's holiday time, you're going shopping, you make your budget, and then you get to the store. A thought could be, oh, I should get this, even though it's outside of my budget. You might buy it, or you might feel like a strong desire to, anxiety about going outside of the budget, but maybe you'll do it anyway. You'll spend outside of your means. That could lead to more thoughts, right? And longer term distress. If you can't engage in stimulus control, right? You're not able to spend as much as you're hoping to financially, that's okay. I want you to then focus on values. What is the purpose of giving gifts during the holiday season, right? What are you trying to show your friends and family? Is it love? Is it support? Is it thoughtfulness? And if so, what are some ways you can show those values? You can act in alignment with your values without spending money. So perhaps that looks like a handwritten card, a DIY, do-it-yourself gift. So anything you can do that is still aligned with the values of giving. Also starting early, right? So starting early, start planning. I know holidays are approaching very quickly. For some people, they might be less than 10 days away, but still really trying to plan and start as early as possible. Family. So family is a tricky one. Some family stressors might include just being with family, maybe not being able to be with family during this time, so loneliness, as well as social pressures of what family life is supposed to look like. So again, stimulus control, what can you do? You can set boundaries. You can still set boundaries with family. You can say no, you can put your needs first, right? All of those things are okay if you're acting inside of your values. You can connect virtually, right? So if you're lonely and you're not able to travel, again, calling and reaching out to family members. You can practice gratitude and remembering your values, right? So returning to the things that feel good, the areas of your family life that you are thankful for can be a really helpful exercise to shift the mindset and shift perspective, as well as this idea of responding versus reacting. So I saw this in the word cloud that somebody wrote something about in-laws, right? So if somebody says or does something that irks you, that bothers you or annoys you during the holidays, remembering the idea of responding versus reacting. So reacting is impulsive. It is emotionally driven. It can be maybe a snippy remark back or avoidance of the person. Whereas responding is more thoughtful. It's intentional. So if you can put some distance, some space between yourself and the stressor and practice responding versus reacting, it might help keep family dynamics in a more relaxed, in a less stressed environment. Diet. Okay, so diet. Some concerns about diet in the holidays can include calories and weight gain, comparing yourself to others, looking bad for family. And so what can you do about this? So starting with stimulus control, you can eat smaller meals, you can continue your exercise routine, and remember, don't skip meals, right? If you know you're having a big meal with your family, continue to eat throughout the day because skipping meals can lead to binging, right? So eating a whole lot in a short amount of time. You can also modify your mindset. So reminding yourself, it's only a few meals, right? Holiday season doesn't last forever. Enjoying a meal is not cheating on a diet. And remember that you believe the narrative you tell yourself. So reframe your thoughts, right? If you're going to eat the mashed potatoes, you might as well enjoy the mashed potatoes instead of eating the mashed potatoes and thinking, oh, I shouldn't be eating this, right? Another should statement. I should be eating something else. Now you're not even enjoying the experience. So one way you can practice enjoying eating your holiday meal is through mindful eating, which is engaging all of the senses and having a sensory eating experience. So focusing on the color of your food, the texture, what it feels like in your mouth, the tastes, the scents, right? So you want to get into this awareness of the present moment without judgment, which is what mindfulness is. All right, unreasonable expectations. So unreasonable expectations. When expectations are higher than the demands of reality, it leaves room for disappointment. So what can you do? You have two options. You can manage reality, right? Stimulus control, or you can manage expectations. So changing the mindset. So with managing reality, can you change anything? Can you change the situation? Can you change the stressor? What, how, and when? Is there anything you can change about what you do if you can't change the stressor itself? And if you've done all you can to change things for the better, then maybe that's how things are right now. In practicing the mantra, it is what it is. So if you can't change or manage reality, you can work on changing and managing expectations. So is there another way to look at things? You can also explore deeper what your expectations are about the world, about others, and about yourself. And a useful exercise that you can engage in is, what would I say to a friend in this situation? Right? What advice would I give someone else? And then trying to really take that in. Right, so those were some examples of stressors and how to cope. But I want to conclude by leading everybody through a peaceful place meditation. So this meditation can be done anywhere, anytime. So I'm going to be reading you a prompt, and I'd like you to try your best to follow along with me and focus on what I'm sharing. So the purpose of this peaceful place relaxation is to relax your mind and to guide you to imagine your own peaceful and safe place. So this place can be a real place, a place you know very well, or imagined. Perhaps it's a place you'd like to go to, but be sure it's a place you can visualize to help calm and relax your mind when you're feeling stressed. So I'd like you to find a comfortable seating position. I'd like your posture to be dignified, but not erect. And if you feel comfortable, closing your eyes or lowering your gaze. So for the next few moments, I want you to focus on calming your mind by focusing on your breathing. Allow your breathing to center you and relax you. So breathe in and out. In and out. So continue to breathe slowly and peacefully as you allow the tension to start to leave your body. Release the areas of tension and holding. Perhaps it's a furrowed brow or a clenched jaw, or your shoulders or at your ears. Trying to relax your muscles as you get comfortable in your seated posture. Continue to let your breath relax you. So breathe in and out. And now I'd like you to follow along with my prompts for breathing. So you're going to breathe in, 2, 3, 4, hold the breath, 2, 3, 4, exhale, 2, 3, 4, hold the breath, 2, 3, 4, again. Inhale, 2, 3, 4, hold the breath, 2, 3, 4, exhale, 2, 3, 4, hold the breath, 2, 3, 4. Now continue to breathe slowly, gently, and comfortably. And let the rate of your breathing become gradually slower as your body relaxes. Now I want you to begin to create a picture in your mind of a place where you can completely relax. Imagine what this place needs to be like in order for you to feel calm. Start with the physical layout of the place. Where is this peaceful place? You might envision somewhere outdoors or indoors. It may be a small place or a large place, but whatever the place, creating an image of it. Now picture some of the details about this place. Who's in the place? Are you alone? Or perhaps with someone else? Are there other people present? Animals? Birds? Now focus on the sounds in this place. Do you hear waves crashing on the sand? Birds chirping? Perhaps the sounds inside a home of a comforting meal being prepared? And now imagine any tastes and smells that your place has to offer. Can you smell a salty breeze? Can you taste that on your lips? What about the fresh air of a crisp fall day or chicken soup on the stovetop? Now imagine the sensations of touch, including the temperature of your place. Is there a breeze present? What about the surface you're sitting on? Imagining the details of this calming place in your mind. Now focus on the sights of your place, the colors, the shapes, the objects, the plants, the water, all of the beautiful things that make your place enjoyable. Now to add further detail to your place, I want you to imagine yourself there. What would you be doing in your place? Imagine walking around or sitting or doing a variety of activities. But picture yourself in this place and picture yourself feeling calm. A place where you have no worries, no cares or concerns. A place where you can simply rejuvenate, relax, and enjoy just being. Enjoy your peaceful place for a few moments more. Memorize the sights and the sounds and the sensations around you. And know that you can return to this place in your mind whenever you need a break, you can take a mental vacation to allow yourself to relax and regroup before returning to your regular roles. So in these last few moments, create a picture in your mind, right, that you can return to. Imagine filing it away in a filing cabinet in the back of your mind, and it'll be waiting there for the next time you need it. So when you're ready, beginning to wiggle your fingers and toes and turning your attention back to the present. Notice your surroundings as your body and mind return to their usual state of alertness and wakefulness. But keeping with you this feeling of calm that your peaceful place brought you to as you return to your everyday life. All right, so that's it for the presentation, but I'd love to hear any questions or thoughts that anyone would like to share.
Do we have any questions?
Does anyone want to share how yes, somebody just did. I was going to say, how was the exercise? How was the peaceful place? Did anybody have a place in mind that they were able to go to that they'd be open to talking about?
Oh, I see Larry.
Yes, Larry.
Hi, Nicole. I do what's called meditation on steroids. I have a web page, because I program in HTML, of a bunch of links: kittens purring, rain on the roof, the ocean, all that fun stuff. So I mix and match 2 or 3 of them. Then I light up a little Neroni oil in a warmer. I also have a link to a kaleidoscope image. Sights, sounds, smells. I set the stage first, because I know there are fibers from the visual cortex, the olfactory cortex, the auditory cortex, going down to the limbic system. And that's what gives you the emotional wallop from sights and sounds and smells. So I do all that first. I got a meditation tape. I've been running the same one for several years. It's an okay tape, but it's the same one. So I built a Pavlovian conditioned response using the sights and the sounds and the smells. I can drop my blood pressure 15 millimeters of mercury in 10 minutes reliably. And I find that hugely valuable. So much so that I can be on the train in the Amtrak. Worse, I'm in Penn Station waiting for a train and close my eyes. I can remember the smell. I can remember the sounds. And as a conditioned response, I can invoke it. That's my meditation on steroids.
Larry, that's so wonderful to hear. And it's a perfect example of how these exercises they're like a muscle or learning a new skill. The more you practice it, the stronger it becomes and the more reliably you can use it. So practicing a meditation that you really enjoy and implementing it into your day-to-day can allow you to call upon it when you need it. Right? So like you said, you've been Pavloved, you've been conditioned to associate those thoughts and that place with relaxing. So continuing to practice these sorts of meditations, whether it's peaceful place, whether it's a different mindfulness exercise, whether it's progressive muscle relaxation, but making it a part of your daily or weekly routine. So that's really great that you've been able to do that.
I see some comments in the meeting. Alan said the breathing exercise was very relaxing. Sydney said, thank you for that guided meditation. Julie said, this was great. Leslie said the same thing. Alan also mentioned he was at a beach at St. Thomas.
It's so nice to see where everybody pictured themselves. I'm noticing everyone pictured themselves outside.
Yeah, I noticed that too. You mentioned that everyone was outside under the sun.
Yes. Yeah, there's a lot of different a lot of sensory experiences that can happen when you're outside. Minus the bugs. Yes, Sydney. No bugs in the peaceful place. Only peaceful and relaxing animals or creatures. Any questions about stress in the holidays?
The unifying theme to a lot of what you said is the word planning.
Mhm.
You know in advance what kind of nutcase is going to be inside once they open that door. I know Uncle Edgar's going to drink too much and Cousin Sal's going to be in the corner weeping, but I know it in advance. It's supposed to open the door and be slapped in the face. Oh my God, there's Cousin Edgar drinking again.
Mhm.
Planning helps.
Yeah, so that's expectation setting, right? So if you can have expectations that meet reality, right? You expect all of those things to happen, then there's no room for disappointment because you already knew it was going to happen. Might those things be disappointing if Uncle so-and-so drinks too much? Sure, absolutely. But it's not a surprise.
Any more questions or comments? Okay, if not, then I guess we'll end the presentation. Thank you so much, Dr. Butler. I'm sure everyone enjoyed it. And people are saying thank you so much for coming. And we hope to, we could do this again.
Yes. Well, thank you for having me. And I wish everybody a joyous holiday season.
Yes. Okay. Bye.
Namaste.
Happy holidays.
Happy holidays.